My name is Josh, and I'll be presenting the influence of polycystic ovarian syndrome on the endometrium. PCOS affects 8 to 13% of reproductive age women, 21% in indigenous populations, and around 70% of cases remain undiagnosed. It has a complex disease presentation with many risk factors, pathophysiological presentations, and clinical presentations. It is largely characterized as a metabolic disease. Clinically, PCOS is diagnosed with features such as hyperandrogenism, ovulatory dysfunction, and polycystic ovaries on imaging, but diagnosis is often complicated by overdiagnosis, inconsistent criteria, and hormone variability. Patients also face comorbidities such as mental health disorders and endometrial dysfunction. This highlights why mechanistic models are needed to separate ovarian contributions from direct effects on the endometrium. Anovulatory infertility occurs in about 70 to 80% of cases. Abnormal destigitalization reduces receptivity, and miscarriage risk is around 50% higher than average. The risk of developing endometrial cancer is nearly threefold higher, rising from 17 to 46 cases per 100,000. This demonstrates why studying the endometrium in PCOS is clinically significant. Rats exposed to excess androgens with or without insulin showed androgen receptor abundance remain persistently high. Normally, this declines at specific stages to allow for implantation. Instead, sustained AR-disrupted receptivity genes such as SPP1 and PRO lead to implantation failure and mitochondrial damage. So overall, hyperandrogenism leads to sustained androgen receptors, causing defective gene regulation, leading to infertility. This model highlights a mechanistic link between androgen excess, mitochondrial damage, and failed implantation. Hormonal controls are also tightly regulated, and rats are ethically sustainable. However, the limit is that they differ structurally, and also rats have a shorter gestation period, which reduces the translational accuracy between the two studies. A second rat study examined oxidative stress through GPX4, which is an antioxidant enzyme. In PCOS conditions, GPX4 was deficient, impairing the ability to prevent ferroptosis, a lipid-driven form of cell death. DHD and insulin exposure reduced glutathione levels in the gravid uterus and increased the glutathione disulfide levels ratio. It also caused mitochondrial collapse with swollen and poorly defined cristae. This reason connects PCOS to oxidative inflammatory environment that predisposes the endometrium to dysfunction and possibly carcinogenesis. Additionally, endometrial organoids models and in vitro cell lines demonstrate that GPX4 deficiency facilitated remodeling of the extracellular matrix via the activation of TGF beta-1 SMAD2/3 pathway. Strengths of the study include measuring changes at critical time points of pregnancy and the fact that both rats and humans share urotonic regulation. However, limitations outline that symptoms were induced pharmacologically, therefore doesn't reveal the effects of chronic multifactorial presentation of PCOS. Additionally, it only focused on the gravid rats, meaning that findings don't generalize to all women with PCOS. Fertility outcomes also weren't directly measured, and rats metabolize antioxidants differently, which complicates the translation. Human endometrial organoids derived from PCOS patients provide a closer lens. They showed increased inflammatory gene expression, reduced receptivity-related genes, and minimal AR expression. This opposes the rat AR model, where AR remained elevated. The reason is that androgen signaling in humans may work through more complex or even opposite pathways. This highlights the need for human-specific models. Strengths included well-defined experimental groups, but it was limited in the sample size and lack of autoimmune or endometrial cells in the culture. Human studies also revealed pro-inflammatory cytokines, reduced antioxidants, and increased oxidative stress. This aligns directly with GPX4 findings in rats, reinforcing the reason that oxidative stress causes inflammation, causing endometrial dysfunction. Chronic inflammation markers also correlate with increased cancer risk, with higher CRP increasing the risk of both endometrioid and non-endometrioid subtypes. Here, the reasoning change extends to oxidative stress in rats to inflammation in humans, causing measurable CRP levels, heightening the cancer risk. When comparing animal models, some findings align, with some species showing oxidative stress driving inflammation. However, some findings oppose each other, with AR abundance high in rats but minimal in organoids. Some also add nuance, with rat oxidative stress findings translated into cancer endpoints in humans. This shows that multiple models are necessary, with animals explaining mechanisms and humans showing the outcomes. To summarize, PCOS disrupts endometrium through hormonal, oxidative, and inflammatory pathways. Rat models explain these mechanisms, while human models confirm these mechanisms. Overall, we can begin to understand the complex mechanisms to help improve clinical outcomes, explore translational understandings, and guide better treatment options for PCOS. Overall, these findings indicate an increased requirement to better understand the complex mechanisms and the subsequent challenges experienced. Thank you for watching my presentation, and hopefully it was educational.